Welcome, friends, to another Prescriber Spotlight. This is Michael Collins, owner and pharmacist of Healthway Compounding Pharmacy. And we're back today with Dr. Tapuzian. Dr.
Oh,
Tapuzian.
yeah.
Yeah, you with us?
Yeah.
Yeah, you kind of look a little down today. Normally you're pretty bright and chipper.
Yeah.
So what's kind of going on?
I ran out of my vitamin D, my D3 and my B12 level.
Yeah.
My
We
B12.
know how important that is to keep mood elevated.
And, if I stop taking my B12 and my vitamin D, I start getting depressed.
Huh, okay. I get it. I understand that. So
I need to pick up some out here.
some supplements.
Yeah.
Yeah. So that's kind of nice that at least you know when you're depressed,
yeah,
right? You know what it
absolutely.
depends on,
Yeah.
and there's different kinds of depression. Now we don't mean this talk to be in exchange for seeing your physician or a prescriber
Oh,
like
sure.
you, right? In other
Right.
words, we're not
Yeah.
giving medical advice,
Yeah.
so to speak.
We would never do that.
No, because it's got to be specific to the patient, right? That's what this is all about,
Sure.
anyways.
Yeah.
But in general terms, a lot of times people can become depressed because of many things that are not evident, like your dog dying or something like that,
Sure,
right?
sure.
There's a reason
Well,
for
there's
someone to be
reasons.
depressed over that, right?
Right.
Yeah.
And there's obvious reasons why people might have depression, but there might be reasons that aren't obvious. Like, for example, there's some simple things like sometimes people will be depressed when they wake up in the morning. Well, it might be because they're taking too much melatonin, or they might be on too much progesterone. Then there's, of course, there's the thing is, there's so many things you can test for to see if it's causing your depression. Thyroid's really important. If your thyroid's too low, if you have low hormone levels, like if your testosterone levels are low, men and women, if your estrogen levels are low, there's a lot of things, and the idea is to find the underlying cause of what's causing your depression, versus I'm going to go there. I'm going to go.
Sure,
I'm going to go
sure.
this place.
Go ahead.
There's sometimes you might go to your physician and you might be going in for anxiety or insomnia, or might be having panic attacks, and your doctor looks at you and he says, I think you're depressed, and you're like, no, I don't think I'm depressed. He says, yep, I think you are, and they end up putting you on a antidepressant. And the thing is, you can't, it's not anything that the doctor's necessarily doing wrong, because they go to lectures and there's studies out there that show that depression may present with other symptoms first.
Right.
So then that's what they're doing. But the problem with that is that they're not trying to find what the underlying causes of your symptoms, whether it's anxiety, depression, panic attacks, etc. You really need to find out what the underlying cause is. And usually functional medicine, or a doctor that's practicing functional medicine, integrative medicine,
Like Dr. Tapuzian.
like me, but I'm not saying that you have to come me. Depending
Understood.
on where you live, you go online and you try to find a functional medicine physician so that you can find the underlying cause of a problem, because it's probably not a Prozac deficiency.
Right. And that's many times patients will come into our pharmacy and they're saying that, I just don't feel depressed and I don't like the way I feel on this medication. Are there certain supplements, nutritional wise or etc., things that we can take? And so sometimes we can try a few things before they actually delve into it. But if they've
Sure.
tried some things like 5-hydroxytryptophan or some
5-HTP.
other things, 5-HTP, and they're not making progress, then that's when I refer patients to physicians like Dr. Tapuzian.
Sure. And so just FYI, 5-HTP, you're not supposed to take it if you're on an SSRI, which is like the antidepressants. But there's a couple other really simple things that you can take too, like ashwagandha or Panax ginseng. Okay. Now, if you're pregnant, these herbs you may not take, and it's always a good idea to ask your physician about it ahead of time. Or if you're a youngster, if you're under 16 years of age, it might not be something that you should be taking. But again, check with your doctor. But yes, these are things that will help with depression and anxiety, and they pretty much don't have any side effects.
Perfect. Hey, so let's review. How do they get a hold of you? How can patients see you? Where are you located, and how do they get a hold of you?
Well, we're in wonderful Saginaw, Michigan right now. So we have an office up here, and I'm also in Bloomfield Hills and St. Joseph, Michigan. You can go to our website. It's askdrt.weebly.com, or our telephone number is 248-302-0473. And then if you need to get a hold of the pharmacy,
Mike Collins, Healthway Compounding Pharmacy. Our phone number, 989-791-1691. You can email me at mcollins@healthwayrx.com. And, of course, our website is healthwayrx.com. But check us out on Facebook. Like us on Facebook. Like Dr. T on Facebook.
Thank God
we
for
have
compounding pharmacies.
Mutual Admiration Society, and thank God for functional medicine physicians, too. So we love all you guys and hope that you're staying healthy out there.
Of you. There's a few out there. I don't know.
We pick and choose on it. So
yeah.
stay healthy, my friends.
All right. Take care.